him bringing to residents of this country health care for the very first time. Something that a lot of presidents had attempted, both Democrat and Republican, and it took President Obama to deliver on that.
Well, let's talk about Obamacare in South Carolina. Let's discuss Medicaid. I was in church Sunday at a small church in Pamplico, South Carolina, Mill Branch AME Church. And before the minister began his sermon, he said this. He said, "Folks, I need you to call your representative about Medicaid. We need it in this state. We've got poor people in this state, people who fall in the cracks. They can't pay out of pocket. We've got 194,000 South Carolina residents right now who can't pay for health care. A family of 3 with an income of $12,271 makes too much for Medicaid. Adults without children don't qualify." Now, in 2013, nearly a quarter of Black Americans in the U.S. had no health insurance, compared to 14% of whites. What is it? This is federal money. Why can't we get Medicaid in South Carolina?
The first reason is that because of the politics of it, it's not as the substance. Most people recognize that health care ought to be available to everybody. And I'll give you a perfect example. We just passed our budget last year. The state budget is $7 billion. Our governor turned down $12 billion in health care. So does that make any sense? Especially if that $12 billion can help people get access to quality health care. It's the politics of it. It's not the substance of it.
It's about race. Race matters in this country. The fact that President Obama is a man of African descent, that he has been successful in getting a program passed into law that, quite frankly, is a Republican idea. The Affordable Care Act is patterned after something that the Heritage Foundation came up with, that Republicans used to support, and they supported it up until the fact that President Obama said, okay, if the Republicans are for this, then let's go with their plan as opposed to something called single payer. So I like to be just very clear about things. From my perspective, and it's my opinion only, we are not expanding Medicaid because President Obama has asked that it be done. The problem with that, in addition to what Senator Matthews has said about the amount of money that we're leaving on the table, is the amount of jobs that would be available here in South Carolina if we had expanded Medicaid. There was a study done at USC when the legislature was first considering this. There is about a $444 million impact from an economic development standpoint, had the state decided to accept Medicaid. And the bottom line for me, aside from the economic argument, the fact that we are turning back federal dollars that our South Carolina residents have paid taxes on, bottom line is if we had expanded Medicaid in South Carolina, like they've done in so many other states, Republican states across this country, so many people who have fallen through the cracks because of the cost of affordable care would be covered. The whole idea was, let's make it affordable, let's have states expand Medicaid, everybody gets covered. And when you get into the politics of it, the politics of race, we're just where we are. With our governor thumbing her nose at the federal government, what your listeners might want to appreciate is that we are very selective here in South Carolina about what federal dollars we take. We took federal dollars and are taking federal dollars to deepen the port in Charleston, but we can't take federal dollars to provide health care coverage to South Carolina residents. There's no rhyme or reason to it from my perspective.
You know, one of the things that Republicans has done in this state, they have convinced poor white folks to vote against their best interests. And if you look at the statistics, 45% of all the people who are eligible for the Affordable Care Act are white folks. Only 35% left are black folks. So they have convinced them to vote against their best interests because of race in Obamacare. And that's the tragedy. I think one day when they wake up and find out that these guys have been selling them a bag of tricks for all these years, I think they're going to turn on them. The issue here for health care, for them, they are the majority loser at this point.
I understand it's about $12 billion that she could receive between 2014 and 2020.
Right.
$12 billion. And I'm going to play devil's advocate a bit. She said that it would be a burden on taxpayers. That's the reason we cannot accept Obamacare, because people need to take responsibility for their health, and it would just be another burden on the taxpayers of South Carolina.
No, that's baloney. If you look at the facts, those are Republican scare taxes that they used when Obama started health care. They say it would bankrupt the country. It wouldn't be affordable. If you look at health care costs today versus before the Affordable Health Care Act, the cost of health care is not going up as fast. If you look at the amount of revenue, if we were to take those $12 billion, we will create 40,000 new jobs at least. And those will be high-paying jobs. It will pay for itself. It will add quality of life. It will pay for itself. So to me, it makes no sense not to accept the federal health care money, because not only are we helping people, but we'll create jobs and opportunity for our citizens at the same time.
We've got to take a break, but when we come back, we'll talk more about Medicaid, and we'll talk about the late Senator Clemente Pinckney. That's when we come back to Health Matters. Stay tuned. Welcome back to Health Matters. We're here with Representative Gilda Cobb Hunter and Senator John Matthews. We're discussing Medicaid.
And I just wanted to follow up on your question about the governor's comment about the state can't afford Medicaid expansion. The reality of the rhetoric that Governor Haley and others who are spewing that nonsense, the reality is that the state can't afford to not accept Medicaid, number one. And number two, we're already paying for not accepting Medicaid, mainly through our hospitals who are having to provide care through emergency room visits. People who have no primary care physician, no medical home, are going to hospital emergency rooms to be seen. We as taxpayers are paying for that. If you're out there listening to this and you have insurance, you're also paying for it, because insurance companies are passing the cost of uninsured care to those of us who are insured. The other point that I think needs to be made on the issue of costs is twofold. One, when the Affordable Care Act was first passed and implemented, the federal government was paying almost the entire portion of the cost of states expanding Medicaid. That cost grows over a few years, but the most that any state will pay to expand Medicaid is 90% of what the federal cost is. I'm sorry, I got that backwards. The most any state will pay is 10%, because the federal government will cover up to 90%. The other thing is, it's so nice to have time pass between allegations and accusations and reality. And what we know now is that since that law took effect, there has been research that has documented the amount of money that states have saved where Medicaid has been expanded. There are studies that now show that all the lies that were told about the increased cost, those lies have been refuted with statistics. So the bottom line is, South Carolina is paying for the state not accepting Medicaid dollars and expanding Medicaid. It's just who is paying. And the people who are paying for us not accepting it are people who already have health care insurance, and our hospitals by people who are not insured showing up in their emergency rooms.
And it's also a matter of life and death.
Without question. Yes. People are losing their lives, particularly when you think about rural communities and access to care. I mean, it just makes no sense.
You know, there are two other issues here, I think. And I've told people that I think the governor's decision not to accept the Affordable Health Care Act is really a death sentence to a lot of people because they cannot get access to health care. But I think there's another issue out there that's floating around that to me makes some sense. I think it's a federal denial of equal protection and equal access. I pay federal taxes in this state. I got brothers paying federal taxes in New Jersey. You can get health care in New Jersey. I can't get it in this state, but I'm paying my federal tax. I think it's an equal protection legal challenge can almost be brought against this state because as a citizen who pay federal taxes and being denied the services that I can get in another state, I think it's an equal protection question that we really need to look at.
I was doing a little research for the show, and I ran across this. Medicaid expansion in South Carolina would save the lives of 190 people every year, according to a recent White House report. Now, I've also heard that State Senator Clemente Pinckney's death in the Charleston massacre may have some type of influence over Governor Haley because he wanted the expansion of Medicaid as well as taking down the Confederate flag. Do you think that will have any type of input?
I really think that his death resonates with people. Not only his death, but how his church reacted to it. Whether that will be carried over to the next session, I don't quite think so. We have a very right-wing, difficult, don't care Senate and House, and our leadership at the top. But I do think because of the issues that he supported, he was a sponsor of the legislation in the Senate to make Affordable Care Act available to everybody in the state. That will be introduced again this year. I think his death, and because of his blood, will help some, but not that much.
I don't think Senator Pinckney's untimely death will have any impact on Governor Haley deciding to expand Medicaid. And she is on record in a number of publications since the Emanuel 9 saying that she will not expand Medicaid. What will have to happen in South Carolina, in my view, is for some faces in the legislature to change and for people to put a thumb in their spine and find the courage to do what is the right thing in spite of what the governor says or does. Unfortunately, in the South Carolina General Assembly, we don't have enough men and women in leadership and in positions of power who have the intestinal fortitude to make the right decision. What I am pleased about is that as a result of the untimely death of the Emanuel 9, we did see the flag come down. But in the words of Reverend Jesse Jackson, we've removed the flag, but not the flag agenda. And Medicaid expansion is a part of the flag agenda. Equity in educational funding, making sure that a kid is able to go to school and get a quality education, regardless of where he or she lives, is a part of the flag agenda. So while I celebrate the symbolism of the flag coming down, I think we need to be focused on the substantive issues that still face South Carolinians. And until we do that, we really are just, no pun intended, whistling Dixie.
Well, on that note, we're going to come right back and we're going to talk about what the citizens of South Carolina can do to expand Medicaid, if that's what you want, and to improve the situation for thousands of South Carolinians. We'll be right back with Health Matters right after this. Welcome back to Health Matters. I'm Kathy Andrews. I'm here with Representative Gilda Cobb Hunter and Senator John Matthews. We're talking about health care. And a major health issue, especially in South Carolina, is violence. South Carolina is number 2 in the nation for domestic violence, and specifically men who kill women with handguns. I think we've been in the top 10 for the last 10 years. In fact, truth be known, South Carolina is probably one of the most violent states in the nation, according to the Justice Department. South Carolina is number 6 for violent crime. 500 violent crimes per 100,000 residents reported in 2013. What are we going to do about violence in this state?
I'm gonna go first. I think there are a couple issues here that you got to understand the psyche of the people in this state. I was reading an article the other day that in Texas, you can use your permit to carry a gun to vote, but a college student can't use their ID to vote. And so the question is how right-wing and far we can go, denying people an opportunity to vote or the right to vote based on some principle. Until we convince a larger part of the white community to change their views and to look at reality, it is difficult to change things in the General Assembly because it is a majority white in the General Assembly and the Senate is majority in the House. And so to change, now we can talk about it, but to change it, we've got to change in the hearts and minds of some of those on the other side of the aisle.
You know, this is something, Kathy, that is very personal for me. I've spent almost 40 years working in the area of violence against women and families, and it is what I consider to be my real job. As you pointed out, South Carolina has been in the top 5 when it comes to violence in families, violence against women for the last 10, 15, 20 years, almost since as long as they've been keeping that stat. The past year, the General Assembly passed domestic violence legislation largely because of a series of articles in the Charleston Post and Courier that chronicled the number of deaths, the number of women who've been killed by their husbands, spouses, etc. So when we talk about what we can do, there are some things that have been done, but quite frankly, in my view, it is almost like the White House campaign that is talking about sexual violence when they say it's up to you. Violence is a learned behavior. The problem is way too complex for a very simplistic solution. When we talk about violence in families, we've got to acknowledge that it happens in all families, regardless of income, regardless of race. It happens to all people, whether they are same-sex, hetero, or whatever. When we talk about ending violence in our communities, we have got to start looking at how we are rearing our children, the messages that our children learn in our homes. When mama beats daddy up every Friday night or daddy beats mama up every Friday night, kids grow up thinking that that is normal behavior, that that is how you settle conflict. And unless we go into our schools and our homes and our churches and get people talking about it, it's not going to end. We've got to stop preachers from telling women who are in domestic violence relationships that it is their duty to stay in an abusive marriage or an abusive relationship. We've got to teach our young men that when women say no, they mean no. And we've got to stop letting every man and his brother, every sister and his whatever get a gun. The access to guns in South Carolina and in this state is too accessible. It's too easy to get a gun. We block everything. The NRA has too much power over elected officials at every level. And it goes back to our earlier point about expanding Medicaid. Until we start electing men and women who have the intestinal fortitude to stand up for what is right, and in this instance, what is right means telling the NRA there is nothing wrong with requiring background checks. There is nothing wrong with saying if you are a private citizen, you don't need an AK-47 and all of these weapons that shoot all of these rounds military-style weapons. We've just got to get real. And every tragedy, we have the same conversation about gun violence. You know, some of us remember a few months ago in June when the Emanuel 9 were killed. It was all about, oh, let's do something about this. Well, we've had 3 or 4 more shootings, at least 2 this week. The Roanoke, Virginia shooting of the news reporter and the cameraman, the senseless killing of the police officer in Houston. So we are a violent country, and what Americans need to ask themselves, along with South Carolinians, is why is it that we are the most violent country in the world?
Absolutely.
Why is it so easy for Americans to get and buy guns? Period.
I think statistics also show that there is no relationship where guns make the population safer and more secure. Every country or every state that allow easy access to guns, violence is up.
And you mentioned something before, Senator, about Texas using the permit as a voter ID. Well, I read where there are 722 unjustifiable deaths as a result of people who have concealed weapon permits. So just because you have a concealed weapon permit does not mean that you won't go out and kill someone.
You know, for some reason, guns empower people's psyche more.
It makes them feel.
It's just like cops
powerful.
carrying guns. It give them a sense of authority, a sense of I can be over you. I can do what I want to do. It's a sense of you can frighten people, and so it is not. Guns haven't been used as to protect people. It is being used to abuse people
and intimidate people.
It's clear to intimidation.
And there's a lot of intimidation going on that we don't hear about. Out in
Not
rural areas.
you know, we tend to listen to the high-profile cases like killing of the cop in Texas, which should, you know, everybody against that kind of thing. But we've got guns in our community killing each other every day. At a number, we're killing more people in this country by violence than we kill in Vietnam.
Absolutely.
And so
Absolutely.
there's clearly something wrong with that kind of psychology. And there's something wrong with people who think they have a right to carry a gun. And if you have a gun on you and you get into an argument, tempers flare, that's the first thing you're going to use. Now, when I was growing up, we probably had as many fights as they had today, but never with guns.
And that's the difference.
And that's the difference.
And we have a lot of people with psychological problems, PTSD. We didn't get a
Right.
chance to talk
Yeah.
about veterans
Right.
and just regular people who are walking around with post-traumatic stress syndrome from some tragic event in their life.
That has easy access to a gun.
That's right. I wish we had more time. Thank you so much, Senator Matthews, and thank you, Representative Cobb Hunter.
Thank you.
I appreciate it. I hope you guys out there will call your representatives. Let them know how you feel. Is there any particular phone number or anything that citizens can do to make a change?
The bill that we're planning to introduce in the Senate will be S-845. A lot of time when you call the General Assembly, you need to be specific. That will be the bill number that we will introduce, S-845, that will deal with access to affordable health care.
Thank you. Thank you. And thank you, folks, for listening. I'm Kathy Andrews, and you've been listening to Health Matters.